Hello, I'm Dwayne Townsend. I'm a physician. I'm board certified in obstetrics and gynecology and gynecologic oncology. That is the diagnosis and treatment of the female reproductive tract in women. I'm 75.5 years young. I feel fantastic. I have incredible health. I've had an exciting life, and I really changed the practice of medicine during my 50 years of medical practice. I've been a professor at UCLA, USC, and University of California Davis Schools of Medicine. I introduced cryosurgery of the cervix to medicine. I introduced nurse practitioners. I popularized a technique called colposcopy used in women with abnormal pap smears. I also helped develop a technique where we use radiation therapy with chemotherapy to improve the outcomes in women with advanced cancers of the cervix. And more recently, I introduced a technique called rollerball endometrial ablation to avoid hysterectomy in women who had heavy periods. Well, more importantly, in the last decade and a half, I have found something that I consider an absolutely amazing peptide. It has given me health beyond belief. I travel, I have great fun, and my bucket list keeps growing and growing because I'm in no hurry to take advantage of this spectacular health that I now have. I'm going to talk to you about a number of things that are very important in our lives. Listen carefully, because the things I tell you can change your life as it has changed mine. Now let's talk about abnormal pap smears. 12 million women a year get an abnormal pap smear in the United States. And this is because there's something that's taken place on the mouth of the womb of the cervix that causes abnormality. Most of these changes are due to a virus called human papillomavirus. And this can lead to a precancer change often called cervical dysplasia. However, many women have human papillomavirus but don't have dysplasia. So there are other factors that are very important to making this determination. And one factor really has to be the immune system. In fact, women who smoke cigarettes, who then get a depressed immune system, have a double risk of developing pre-cancer change of the cervix. What do you do when your pap smear is abnormal? Do you have cancer? Are you going to have a hysterectomy? Will you be unable to have children? Well, none of these really take place. In reality, this abnormal pap smear can begin in the early 20s. And the condition is called precancer because if left alone, could someday develop into cancer. But this takes decades and decades. It doesn't happen tomorrow. And I've taken care of over 30,000 women with abnormal pap smears. And none got cervical cancer as long as they followed my advice. And so it's easy to develop a very simple way to manage a patient's problem. And once you have this examination called colposcopy, when your pap smear is abnormal, the healthcare provider can usually tell you what is the precise problem. Many times nothing will be done because it's a mild abnormality which often goes away by itself. On the other hand, it could be a precancer change that requires treatment. This may be a technique called freezing or cryosurgery, which I introduced in 1967. There's another technique where you excise the tissue called loop excision, which I also helped to popularize. Laser used to be done, but it's not in vogue nowadays. And there's an operation called cervical conization, where a large piece of tissue is removed from the cervix. This technique really is rarely, if ever necessary, in a woman with precancer change of the cervix, even when it's advanced, called carcinoma in situ or severe dysplasia. However, recently I've discovered something new. Another way to approach women with abnormal pap smears. That is to build the immune system, because probably the immune system is one of the most important keys in prevention of this amazing disease. And once you improve the immune system, then you can use some other ingredients which have been shown in the medical literature to help these lesions disappear. You want to learn more? Go to my website, askdrtownsend.com. Thanks for watching.